move from the identification of vascular disease to the treatment of vascular disease. The learning objectives were going to discuss the pros and cons of open surgery versus endovascular procedures for improving perfusion. Discuss the various endovascular options, define the goals when we're thinking of revascularization, and discuss the options available to improve perfusion if there's no revascularization that can be performed. The big picture, again, working together, that timely diagnosis and early treatment if treatment is required. So one of the factors, there was a very interesting paper a number of years ago where they looked back in retrospect, this was out of Denver, they looked back in retrospect of patients that ended up with a major amputation despite the fact that they have a very active limb preservation program. And what they found was a delay in referral or a delay in treatment of coexisting vascular disease. So if you identify somebody with an ischemic toe or a wound that's not healing, and you wait for 2 months or a month even to get a vascular evaluation and appropriate treatment, unfortunately that patient may progress significantly during that period of time when you're waiting for intervention. So timely diagnosis, timely treatment when treatment is indicated. So some very key questions when you're talking about the treatment of PAD. Does the patient have arterial disease? We've already talked about the modalities that you can use to diagnose the arterial disease. If they have arterial disease, do they require revascularization? When should the revascularization be done? Timely. I mentioned that you can get into trouble with delayed. And what treatment options should be utilized? Endovascular procedures, open surgery, hybrid procedures. That means that an open vascular procedure is combined with an endovascular procedure in order to establish perfusion. How far distal? If you're revascularizing, do you have to go all the way down to the foot? Can you just treat inflow disease?